So one of the things that Dr. Ivy said to me in the assessment was that I have a vaulted palate. So it's really arched quite highly. And I guess this can sometimes be genetic and sometimes be from the extractive orthodontics. So when my teeth were pulled back and the gaps were closed where teeth were extracted, all the bone had to go somewhere, so it started to rise and create a vault on my upper palate. And this has the ability to affect your airway because it forms the bottom of your nasal passages. So sometimes it can minimize the amount of air that can get in that space. And this, in conjunction with a small transverse space, which I have, like my dental arch is 28.9, so that's like from back molar to back molar, that width across there. When that's also small, the tongue doesn't have enough space to sit properly. So, so in my case, it's caused like a head forward motion just to maintain an open airway, which can be really hard on your neck and your jaw health and comfort, right? It's not very, very good for your health. So this Vivos device, in conjunction with the myotherapy that they do, and that's to work on proper tongue posture and jaw posture and to train yourself into how you're supposed to hold your tongue to maintain good health after so many years of not being able to do that, because I actually cannot hold my tongue the way that you're supposed to for good oral health, and that's pretty important. So the way that you're supposed to be able to rest your tongue is it's supposed to rest on the roof of your mouth, just gently. And then the tip of your tongue is supposed to rest just behind your front teeth. And the sides of your tongue just rest on either side of your upper palate. And then you're supposed to be able to close your lips in that position and then just have your teeth slightly open. So you can go ahead and give that a try. And for me, I actually can no longer breathe when I try and do that. So hopefully the expansion will help to make space so that I can have that wonderful, happy, healthy tongue posture and keep my tongue up on the palate of my mouth like you're supposed to. So what are some of the things that proper tongue posture does for you? Well, it can optimize your jaw position, which actually releases tension in the area and TMJ pain and facial tension in the cheeks. It helps to ensure that your head can sit directly over the cervical spine, which minimizes neck pain and head pain in that way as well. It optimizes your cranial facial function. So just the act of resting on your palate encourages a nice wide open palate, which is great for airway. And it helps you do diaphragmatic breathing, so you get really good oxygen, and minimizes snoring tendencies as well. It also tones your lower jaw and lifts the area under your chin, so helping to remove a double chin. So this is something that I'm looking forward to being able to do, so I can tighten up below my chin, which I do tend to have too much fat accumulated there, even though I'm not that heavy. I mean, I could lose a little bit of weight or gain a little bit of thinness. But it's sort of a disproportionate, I think, the amount of fat that's under my chin compared to my weight. So that's just one of the other lovely things that your tongue can do for you. So proper tongue posture can do amazing things for us, and optimizing digestion is just another one of those by encouraging good swallowing. So I hope you're having a wonderful day, and I look forward to catching up with you when I get my Vivos device again and I can get back on track with this journey. So all the best to you. I will touch base soon.